Bismillahirrahmanirrahim. Assalamualaikum. And a very good day I beg to our beloved speaker, respected lecturers, fellow health professional, and all participants joining us today. Welcome to our webinar on animal bite and sting. My name is Muhammad Yusri Babu and my friend
Lokman Hakim.
We will be your moderator for today's webinar. We are truly honored to have all of you here, whether you are joining us from campus, hospital, clinic, or from your own house. Today's session is more than just discussion. It is important effort to enhance our understanding of pre-hospital and clinical management related to animal bite and one-on-one sting.
To start our session this morning, it's my pleasure to invite Associate Professor Dr. Ahmad Khaldun bin Ismail to give his opening speech. Dr. Ahmad Khaldun is an Associate Professor at the Department of Emergency Medicine, National University of Malaysia. He is also a visiting scholar at the Graduate School of Medicine, Tohoku University, Sendai, Japan, and honorary consultant at the National Poison Center, University Science Malaysia. Prof. Dr. Ahmad Khaldun is well-known for his dedication to emergency and pre-hospital care, and has authored various publications in related fields. We are honored to have him here today. Now, without further ado, let's hear his opening speech. Over to you, Prof. Dr. Khaldun.
Okay, so thank you very much for the kind introduction. I would like to first thank all our team who has kindly organized this webinar forum. I think this is our, maybe fourth or fifth have a good team this year. I'm very happy with them. Secondly, I would like to also welcome all our speakers, our panelists for the forum. Please direct all your questions to them today, and we discussion on the issues regarding bites and stings. So with that, I would like to say welcome to everybody. Have fun, hopefully until the end, where we will have a Kahoot quiz, I think, and with a prize. So with that, I thank you.
Thank you so much, Professor Dr. Ahmad Khaldun, for those inspiring words and great way to start our morning. Full of motivation and purpose, I guess. So now, before we dive into the main event, I would like to invite all of you enjoy a short montage that prepared from our team, an introduction video. So sit back, relax, and let the visual do the talking. Let's go.
What's your emergency?
Stanford. How about patient bed 3?
Oh, patient still in pain.
See, let's see the patient.
Bang, sakit. Sakit.
Hi sir, I'm Dr. Zul. Hi miss.
Please help my fiancé, doctor.
Okay, hi miss. I'm Dr. Zul, doctor in charge today. What happened today?
We were in flower garden.
Okay.
I think it's been bitten by a snake.
Did you recognize what type of snake?
It's a black snake. I think it's cobra.
Okay. Stan and Farah, please prepare me a glove. Thank you. Okay, miss. Can I see wood?
Yes.
Okay, sorry, yeah.
Yeah.
Oh, is it pain?
Yes.
Okay, don't worry. I will give you a painkiller, okay?
Yes, yes, please.
Okay. Sanhara, please prepare a painkiller.
Doctor, should I prepare IV hydrochloride as well?
Pardon? What?
Hydrocodone is the first line medication for those who suffer with snake bite. Should we give that?
Okay, wait, Longman. We are in webinar, right? So we're going to discuss the method even further in this webinar. So guys, think and learn and heard what we're going to talk, right? So meet us, me as your moderator, Mohammed Sugabu.
And Lokman also as your moderator.
So stay tuned.
Wow, that was a beautifully done. Kudos to the creative team behind that. It really sets the mood and reminds us why awareness about animal bites and sting is so important in our line of work. Alright, now for the main highlight, our forum on animal bite and stings. We have a fantastic lineup of panelists today who will share their knowledge, experience, and maybe even a few interesting bite stories.
Okay, Mama. I think we should introduce our panelists. So it's now my honor to introduce our
Love it.
what we call it amazing panelist for today's session. Our first panelist is Dr. Tinesh, son of A. Ravi. Dr. Tinesh is an emergency physician in emergency department, Hospital Tengku Ampuan Amza, Kuantan, Pahang. He is a highly experienced in the field of emergency medicine and clinical management, particularly involving cases of animal bite, envenomation, and toxicology-related presentation. He served as organizer and head coordinator of snake bite and envenom and marine animal poisoning.
Next on the line, Dr. Siti Noor Izni binti Said Muhammad Amin. She is currently serving as emergency physician in Emergency Trauma Department Hospital Port Dickson, Negeri Sembilan. With extensive clinical exposure and a strong background in patient management, Dr. Siti Noor Izni has been actively involved in animal bites and sting seminar organized by various teams.
And the next one is Mr. Adam of Buan Hong bin Abdullah. Mr. Adam is an experienced assistant medical officer and highly regarded accredited trainer specializing in emergency medicine and advanced pre-hospital care in Johor, Malaysia. With over a decade of continuous service in emergency and trauma setting, dedicated to optimize life-saving protocol and enhancing medical readiness both within the hospital and on the emergency line.
Ladies and gentlemen, we are truly privileged to have all our pretty prestigious panelists with us today to share valuable insight, real case experience, and practical approaches that are essential for both learners and medical practitioners. Everyone, feel free to drop your questions in the chat throughout the sessions. We will get to them soon. Let's make this session interactive and fun.
Okay, Dr. Izni, let's start from the scene itself. In an emergency response, what are the essential first aid measures that should be taken before a patient even reach the hospital? What's the right thing and the wrong thing to do at the scene? Dr. Izni?
Okay, thank you for the question, Yusri. Okay, before that, Assalamualaikum warahmatullahi wabarakatuh, and a very good morning. I would like to take the opportunity to thank to the organizing committee for inviting me to this what do you call it, forum. Okay, so back to the question, what are the preparation or things to do at pre-hospital care when we are dealing with animals, things, or it can be marine, it can be from the lands, lands environment. Okay, so for pre-hospital care, team approach is very essential because they are the one who first in contact with the patient. Okay, so for the do and don'ts, okay. Okay, first, the paramedic must be equipped with basic life support. So this is the most important thing because approach to resuscitation is always airway, breathing, circulation, disability, and according to systematic approach. So number one, the paramedic must be prepared with the resuscitation BLS, but I believe all paramedic are well trained about this. Okay. Okay. Number two is what are the things that maybe you need to bring along whenever you respond to case with bites and stings. So I think number one is equipment for pain management. Yeah, you can give simple oral medication. Okay, such as paracetamol is the most safe, the safest one actually, in fact. And then equipment for immobilize. Okay, for example, you need to immobilize using splints. It can be upper limbs or lower limb splints, or if it's not available, maybe you can use an arm sling. Okay, if you encounter the wounds, like big wound, definitely you have to compress the bleeding. Let's say the wounds are bleeding wound, you have to compress the wounds, and also maybe you can use compression bandage. Okay, bear in mind, if let's say you encounter patient with unknown bite because of snake, okay, so you might need to cover the wound with bandage, and also immobilize. Either can using splint or using arm sling. And most importantly is you have to bring the patient immediately to the hospital. I think for the patient, you need to be, you yourself need to be calm upon approaching the patient, and also the patient also might not, the patient must be very panic. So please reassure the patient that we will give appropriate treatment, and also just you need to calm the patient, because we don't want patient to become hyperventilating. We don't want a patient to be tachycardic, because a risk of envenoming may spread faster if the patient is tachycardic. Okay, what else? Okay, probably if let's say if you encounter, like say tourniquet, okay, most in our what we call in Malaysian population, yeah, there are some or maybe certain patient who has this like so-called traditional belief of whenever bitten by animals or by sting, they are going to apply a tourniquet. So tourniquet is mainly you need to tie, maybe they apply tourniquet in the sense of using hair, using rope or whatsoever, maybe using their apa getah rambut kita panggil, okay, so they going to tourniquet the affected limb, so which is wrong. So you have to relieve the tourniquet, and also you have to remove all the jewelries or watch, yeah, around the wherever the patient wore, because you want to avoid constriction along the bitten side. I think that's my answer. Maybe someone else can
Okay,
share
thank you,
their answer.
Daisy. In the montage video earlier, two medications were mentioned, IV hydrocort and also IV Piriton. Are these considered essential in first-line medication for snake bite cases, or should they be used more selectively? Pass to you, Dr. Dinesh.
Okay, thanks to the moderators. First of all, thanks to Prof Khaldun for giving us this opportunity to be here and join the webinar as a panelist, and thanks to all the participants as well. Okay, back to your question regarding the usage of hydrocort and also Piriton in a treatment of snake bite and venomation. So this is not essential medication in treatment of snake bite and envenomation. We don't treat it as per allergic reaction because the pathophysiology of the the disease is not the same as a allergic reaction. So we don't use hydrocot and Piriton as an essential treatment for the management of snake bite and envenomation.
Thank you, Dr. Tinesh. That's a really good point. Um, I'm gonna ask Dr. Yazni again regarding that we talked before, right? So they said based on Dr. Yazni experience from your observation, what is most common mistake they make during the initial management of snake bite or sting cases? Can you share your experience? Dr.?
Okay. All right. Okay. Thank you for the question. So, what are the common mistake? Not really mistake. I think the misconception. Maybe I rephrase it to misconception. So, there are few misconceptions we encounter during snake bite management. Okay, number one, maybe I can categorize this answer to the patient, to the healthcare provider. Okay, but let's say misconception from patient just now, tourniquet application, maybe usage of traditional ointments, yeah, traditional ointments. We are Malay, we have this minyak panas and all, so they're gonna apply traditional ointment before go to hospital, and then maybe delay in seeking treatment because they think it's not serious. So delay in seeking treatment, or maybe they go and visit someone else before go to healthcare facility itself, maybe because of distance, maybe because of financial issue, or maybe they think it's not even dangerous per se because they have no idea about the severity they inflicted by the envenoming. Okay, so that's the patient point. But for the healthcare provider, just now as you mentioned, application usage of hydrocortisone and antihistamine, because it has no role at all. Because the patient, if they came with animal bites and sting, if because of snake, there is definitely no role for initial treatment of antihistamine and steroid. Okay, unless patient is being bitten by stung by bees, there is risk of anaphylaxis, then you can use hydrocortisone, Piriton, as well as, in fact, IM adrenaline. If there is risk of anaphylaxis, that's not wrong. Okay, in terms of healthcare provider, there are a few pitfalls that we encounter, such as the diagnosis made, wrong measurement of rate of proximal progression, because sometimes patient manifest envenoming, so you can see there's an involvement of the swelling of the part of the limbs. So we encounter sometimes wrong documentation, you see, because someone did measure the circumference instead of measure the speed of the rate of proximal progression. So in the end, this can cause morbidity and delay in antivenom administration if indicated. I think that's quite common mistake, but in terms of pre-hospital care, so far I've encountered not much of wrong practice because our paramedic are quite well versed of immobilize, bandage, as well as analgesia.
Thank you, Dr. Isni. So, all right, let's move deeper. Mr. Adam, which are gonna bring us to a crucial clinical decisions. How do you differentiate between mild and severe envenomation during the first assessment? And are there any challenges as paramedic in managing them? Pass to you, Mr. Adam.
Okay, thank you so much, Mr. Moderator, Mr. Yusri. Right. Okay. So thank you. Thank you, Dr. Kaldum, first of all, for the invitation to be a panelist for this forum. It is my pleasure to share in this forum. So first of all, I think your question is challenges as a paramedic in managing animal bite and sting. So I think as a paramedic, we don't actually, in Malaysia, we don't actually respond so much of pre-hospital call regarding bites and sting. Usually the patient or our Malaysians will come into hospital directly if they're facing this kind of emergency. But I do face a lot in I posted in district hospital. So the challenges we can categorize it as, for example, if we go to attend a medical standby. Okay, so the challenges will be the public, the people around us. Our Malaysians seem to be very anxious, especially if bitten by animal or insect. So this is something always happen. So as a paramedic, I think we need to be calm. Okay, we need to reassure the person. That's why we need to have knowledge about the animal and the insect thing. So if we have the knowledge, we have the confidence, then we can explain to the patients, and we can explain to the publics there. They need to be calm first, and then you need to make sure the scene is safe, of course, before you enter as a rescuer or as a paramedic, as a first aider, before you attend the case. So that will be our main challenges as a paramedic in the animal bite and sting. And then in Malaysians, our Malaysians tends to have a lot of funny mismanagement or misconcept about the animal bite and sting. So I can give you a few examples. If snake bite, that tends to tie the tourniquet. So in my experience, 10 years teaching the public usually first question is tourniquet for snake bite. That is the main misconcept in our Malaysian. So we need to explain to the public why we cannot use tourniquet. And then in some district hospital, in some very rural hospital, sometimes the paramedics use some not evidence-based medicine. For example, I give you a very good example. Patients come in with jellyfish sting. They put SSD cream. They said the SSD cream can reduce the pain. So that is something like, as a paramedic, we need to make it correct, especially for our colleagues, amongst our colleagues. That is the first question. So for the second question, what the clinical effect of snake envenomation, right? So usually this the snake envenomation, they will need first of all, you need to categorize what animal, which species of the snake is actually bitten the person. So then the clinical effects will be fall into the specific type of snake. So you can differentiate between local envenomation and systemic. So if local is usually pain, swelling, dermal necrosis, some local effect. If it is a systemic, then it will depend on what type of snake. So for example, if it's cobra crites, then it will be neurotoxicity. Then you will see the 5D classical symptoms. For example, this diplopia, drooping eyelids, and so on. And then you have the hematotoxic snakes. For example, a pit viper in Malaysia. So it will cause bleeding disorder. And then some you will see for sea snake, you will see a myotoxicity. So it will break down your muscle and you will cause muscle pain, myalgia, and so on. So it actually depends on the type of species bitten the patient, and it's whether local or systemic effect. So that's my answer. Thank you.
Thank you, Ms. Adam. That is a beloved point that you given. Okay, our beloved panelists, we got a question on the floor from Winston. Okay, so to all the panelists, Winston asked, he said, I thought by tying a string on the upper part of the bite wound won't slow down the blood flow. First question. The second question is, Could the panelists share knowledge on the stung by ocean animal and reef? First question is about tiring the string at the upper part of the bite wound will slow down the blood flow. And the second question is share the knowledge on the stung by ocean animal and reef. So anyone on the floor, anyone panelists can share experience and give an answer for Winston's question. Thank you, Winston, for the question.
Hello, hi, Yusri. Thank you. I think Vincent, thanks for the question. You asked about I mean the question is about tourniquet, right? By tying a string or whatever, like Dr. Izni explained earlier, hair tie or rope or whatsoever you're gonna tie as a tourniquet. Of course, it's not a recommended management of a snake bite or sting that you see generally the venom flow through your lymphatic system. So by tying tourniquet, actually you are risking worsening swelling at the site. Okay. And more tissue necrosis by escalating the tissue ischemia by tying the tourniquet. So hence, tourniquet is not recommended as a part of treatment for a snake bite. Vincent, can we know a bit more detail? What do you mean by knowledge on the stung by ocean animal? What I mean, the question is quite like a very open question. What is the I mean, what you want to know about the stung by ocean animal? Is it the envenomation or the first aid?
I think what the mission mean is what are the do and the don'ts for bystander or rescuer when handling snake bite or marine sting victim. Maybe a few quick example, especially those myths we'll still see in the rural area.
Okay, thank you. So I think if we going specific about ocean animals, right? Especially what we commonly see here on our side we are so near to a lot of pantai and so on. We see a lot of jellyfish stings and so on. When we talk about jellyfish sting, so there is a lot of myth about this jellyfish sting where people say like should kencing on the leg, for example, like put some urine on the this one. So people don't really, it's not that familiar yet, probably I would say. Compared to snake bite, there will be more awareness. So that is definitely a don't for a jellyfish sting. So mainly patient present with pain. The first line of management is to clean with of course seawater. Don't use normal water or saline whatsoever, because you might trigger the nematocyst to fire and cause more pain and more envenomation. So that's what you don't want. And if there is available vinegar, then that will be one of your management which you can advise to public or educate the public about it. Okay, those are some of the do's and don'ts. Of course, then you have to transport the patients immediately to the hospital for subsequent management of the animal sting. Is that all right?
Yep, Doctor. Thank you, Dr. Tinesh. Next question is from Lato. He's a doctor and professional diver. What interesting. Okay, he asked that if I encounter a situation where a diver is bitten by a snake in the water, what should I do? If the diver need a snake antivenom, what snake antivenom do you recommend? Can we have Dr. Izni to answer that question?
Okay. Okay, thank you for the question, Dr. Lato. Okay, so if a diver bitten by a snake, what should I do? I think before you go diving, definitely there is precaution that should be taken before go into the sea. All right. So number one is your personal protective equipment. Okay. So meaning you have to wear a proper swimsuit that covers all your body parts because you may at risk of in contact with the jellyfish, right? Okay, maybe you're gonna be like step onto a stonefish probably, yeah. Okay, maybe sea urchins, who knows? And also with the idea of entering the sea and do not touch something that is beautiful. What does it mean? If let's say the marine creature is beautiful, so please do not ever approach or try to, try to touch because there is a risk of the creature itself is endangered. Or maybe it will, the marine creature might think us as a predator, what? So they are at risk of sting us. Okay, let's say, for example, like blue ring octopus. It's so nice, but do not touch, yeah, because there is risk of toxin release. Okay, so for this case, if let's say unfortunate event when you are bitten by the sea snake, so be careful, yeah. Sea snake ni once bitten, there is risk of rhabdomyolysis, myoglobinuria, elevated creatine. So the clinical manifestation might be the patient might have pain, especially muscle pain, and also because of myotoxic nature of the toxins from the sea snakes. On top of that, there is risk of neurotoxicity as well. You might have dysphagia, maybe you can have risk of paralysis, and most importantly, risk of respiratory paralysis. So it's most, this is going to be risk of mortality, apnea as a result of respiratory paralysis. So bring the victim out of the sea, and what can you do? So number one is always perform resuscitation, because no point of you having this knowledge but you are not going to perform resuscitation on the victim. All right. Okay, immobilize the bitten part and bring to nearest hospital. So if there is indication of local or systemic envenoming, local envenoming meaning maybe swelling or redness of the bitten part, but the systemic envenoming that we are concerned is like rhabdomyolysis. How do we know? When there is patient having severe muscle pain, elevated creatine kinase, risk of acute renal failure because of the myoglobin that deposit inside the renal tubules, and also acute renal failure. So whenever patient we're gonna insert catheter bladder drainage and drain out myoglobin. So you can see like dark color urine. So you know this is very significant toxicity as a result of sea snake envenoming. So we will definitely give sea snake antivenom. But the sea snake antivenom is only available at the, I think, tertiary hospital nearby the beach. For example, Terengganu, what else? PD, we do have one, Sabah and Sarawak, and also, yeah, when there is envenoming, if the hospital does not have the antivenom, you are going to do resuscitation and try to mobilize the antivenom to the hospital who is treating the unfortunate patient. So yes, the answer is sea snake antivenom. Does this answer the question?
Yeah, thank you, Dr. Isni. Dr. Isni, just to add on, we have questions from the audience giving a scenario. During hiking or jungle trekking, he accidentally tapped on a tree branch that actually is a snake, and then it bite his leg, maybe due to scare or pain. What should he do on that time? Because Dr. Isni, sometimes in the field, not only on the ocean, also in the field, the species is not identified. So how can the emergency personnel rapidly differentiate between local and systemic envenomation, and what to do on that kind of situation? Maybe Dr. Isni can elaborate a few points of it.
Okay, so this is during hiking or jungle trekking where you're alone.
Yeah.
Why are you alone? No friends? Why? Because if anything happen, then how? So should be accompanied lah. But if this unfortunate event occur to this particular jungle trekking, what do you call this? The during activity, unfortunately step on. So again, be calm. Do not panic or run away, because if you know what, when you become panicky and tachycardic and there is a lot of movement from the beaten side, you're gonna make the venom spread faster, because there is muscle contraction, absorption of the absorption of the venom through the lymphatic. So, and tachycardic some more, so it can spread the venom faster. Number one, be calm. Okay. Although we see the snake also, we become very, we're going to be panic, you see. Okay. And then if you have mobile phone, or still in the good sense of mind, you're going to take photo of the snake, because you want to identify what are the possible species, whether it's from the trees or maybe on the ground. So from terrestrial or arboreal. So we need to know, because we are going to make an intelligent guess of the fact that of the, what we call this, the species causing envenoming. Okay, because it's important for our management later. Okay, so how move away slowly. Okay, and also if you have phone with a line, maybe you're going to call 999. Okay, all right. And immobilize, how do you immobilize? Maybe if let's say bitten on the leg, okay, because just now you accidentally stepped on, okay, you might do bandage and try to use other, what do we call this, instrument for you to, maybe you using stick, you have to walk, but try to not using the affected leg to go out of the forest and seek treatment. Or if like very difficult, then you have to wait for someone to retrieve you yourself. And wait for the ambulance lah, mainly. Ambulance, or I think in this case, APM or bomber to retrieve in the jungle.
Yeah, correct. I do agree with Dr. Izni. Thank you, Dr. Izni, for the great response. So I just want to inform to all panelists, we have received a few questions for the audience below. Some of these can be answered directly from the Zoom question and answer. You can see the below Q&A session, because some of question maybe we not welcome, so not some part for answer, right? So back to our discuss earlier. I love to ask Mr. Adam. We still can see a lot of first aid being done by bystander. So what do you think, Mr. Adam, this keep happening, and how can we help improve public awareness and practice regarding the issue?
Okay, thank you, Mr. Moderator. So I think our Malaysians like to watch movie, like to watch the drama series. So that's why there's a lot of misconception about this animal bite and sting, and also snake bite. So they use tourniquet, they suck the wound, they cut the wound, and then they put on traditional medicine, they put on some leaf, they put blackstone. So this how we are going to change this is through education. So that's why we need to educate our public, our Malaysians, that all these steps is actually not going to help in snake bite or in animal bites and sting. It will cause more negative effects on the wound and also the person. So some of them even buy some products from Shopee. So nowadays online shopping, you can get a lot of this type of thing, the venom extractor, the snake bite kits. So they are actually get all this wrong information from the internet. So that's why as a paramedic, I think our rules will be keep educate the person, our Malaysians. That is what the Prof. Kaus always do some trainings, some teachings for the public especially. We have this kind of the Malim Gunung also. Some of them are actually practicing very funny first aid concept first aid to their clients, the hikers and so on. So that's why we need to go by a lot of way to reach our people, that to educate them the correct first aid for animal and snake bites. This is my answer.
Thank you, Mr. Adam. And just for fun, seems like everyone is obsessed with snake bites. Let's switch it up. Maybe Dr. Tinesh, a question. Between bee and wasp stings, what matter more, the species involved or the number of the stings?
Lokman, thank you for the question. Okay, so since we're talking about the bee and wasp stings now, so first of all, we must know how to differentiate bee versus wasp. Sebab I think commonly it's very difficult for people to come and tell you which is which. So most of the time we are very confused which is bee. Sometimes patient will tell gigit kena sengat lebah saja. So they don't really know whether it's really a wasp, hornet, yellow jacket or bees or whatsoever. So it's going to be difficult first of all for species identification. But let me tell you, it actually doesn't matter. The number of sting matters more. When it stings more, when the venom load is more, then the patient is at higher risk to get acute kidney injury, rhabdomyolysis, and what so on. But be mindful for those patients with underlying allergies. So even one sting can be quite fatal to them. So in this case, like earlier we have discussed, then there will be a role of giving hydrocortisons or Piriton, okay, or adrenaline at all if patient has came to us with anaphylaxis due to a bee or wasp sting. So how do you differentiate actually bee and wasp kan? Dah cakap pasal both of them. So usually the bee they have a stinger that they will actually leave it on the skin, and after that actually the bees will die when they sting people. Okay, then it will be actually quite a bit more painful compared to your wasp sting. Tapi wasp ni dia a bit more aggressive. They can repeatedly sting you. Okay, but based on physical appearance, how do you differentiate? Usually the bees are a bit more fluffy, they are a bit more round, they are a bit more hairy compared to your wasp. Wasp ni dia, you see those yang ada very narrow waist shape, yang kecil between the thorax and the abdomen, that is usually your wasp, not your bees. The bees are a bit more cuter, round, a bit more fluffy, hairy. That is the features of bee. But back again to our question, whether is the species or the number of sting matters. Of course, the number of sting matters. The more sting you kena, then it is more fatal and there is a higher risk of complication from the bite.
Okay, Dr. Dinesh, we talk about snake bite, we talk about bee and wasps. So, what if someone suspected a bite from dangerous spider like black widow, but the patient survived the initial phase? And I just curious, is it this patient still needs to provide photo of the spider like we provide photo of snake and obtain the description of the spider as well?
Okay, thank you again. So yeah, now the patient had a spider bite and the patient has survived. Okay, so regardless, patient survived, and of course the description picture or photo of that insulting animal is actually quite important for us, mainly for species identification. Okay, so because some species you can have a delayed complication decision of whether to use any specific antivenom or to avoid any unnecessary treatment for patient. Contohnya, if it's it's a non-venomous or something which is non-dangerous bites, then you probably your management is going to differ. But if at all it's going to be a more dangerous species, of course those patient warrants observation. You need to prolong observing the patient, then the management will be a bit different. So other than that, why these pictures or description of photos is actually quite important is for public health concern, because you somehow that tells you that that area has this particular species. So with that you can actually extrapolate what are the species available at that area, which will be quite important to educate in future. So people will know, okay, this area ada this particular species, so that area punya healthcare providers and all should be more aware on that particular species. So and then we know that specific tailored management for that particular species. So that's why it's quite important to have the picture or description photos.
Thank you, Dr. Tinesh. Next question I dedicate to Dr. Izni. Dr. Izni, doesn't matter in case of snake bite, spider bite, bee sting or whatever matters, but in your opinion, once the patient arrive, how do clinicians decide when to hospitalize a patient after a bite or sting? Is it a purely clinical or are there any standard criteria to hospitalize the patient?
Okay, so when do we decide for admission or discharge or observation? Okay, so for an animal bites, right? Is that the question? Okay, so for unidentified animal bite, meaning it defines as a person who knows it's this animal bitten him or her, but couldn't really get to obtain the pictures, or maybe saw something like slithering away. It can be, centipede, it can be snake, it can be whatever creature on the ground. Okay, so for these animal bites, so we are going to document as unidentified animal bite, but we are going to examine the patient. Number one, clinical, as well as must be supported by the the lab investigation as well. So for example, if we encounter unidentified animal bite, we're going to think about what are the most worst case scenario. For example, is it possible is the most worst case scenario is snake bite? Okay, but we have no evidence, we have no image, we have no specimen that they brought along to the hospital for us to identify what exactly bitten him. Okay, so in this case, we are going to monitor the patient. For number one, we are going to monitor the vital signs, whether patient have hypotension, yeah, whether the patient is tachycardic because of pain, or maybe signs of envenoming. So we observe the clinical symptoms, the pain, the swelling. Is there any dermonecrosis as a result of Naja species? Dermonecrosis is mainly like the bluish discoloration as a result of cytotoxic effect of the local envenoming. So we're going to monitor what do you call this, bitten part, and then we're going to monitor the pain score progression. Okay, so one of the vital signs, pain score is important because consistent pain score 8, 9, 10 over 10 is mainly because of Naja species, cobras, and maybe because of vipers. This is two most common here. And also, pain score progression. And another one is most importantly is the rate of proximal progression. We're going to monitor signs of local envenomation, whether there is increasing the speed of the progression of the bitten part, meaning there is increasing the swelling, edema, maybe redness, and then the tender lymph node. Yes, we have to monitor where is tender and large lymph node because, as Dr. Tinesh mentioned, the spread because of lymphatic circulation, there is the risk of what you call this envenoming, and also there is going to be tender lymph node. If there is an indication for antivenom. But we have to tailor because there's so much antivenom. So which one we're going to administer? Okay, then you go back to the nature of the history taking just now. How do the patient get bitten? The geolocation of the species, potential species, and also the what do we call this? We're going to do serial bite investigation. In this case, unidentified animal bite, maybe we're going to do baseline investigation at first patient presented. For example, full blood count, we want to see evidence of the total white might be raised because of acute stress or acute inflammation or bitten. But most important here, we're going to see the platelet level low, thrombocytopenia. And then we're going to look for evidence of coagulopathy, prolonged INR PTPTT in the case of hematotoxic envenoming, okay, because of viper, for example, or if the patient bitten by what you call CSNP. Yeah, okay, we're going to monitor the CK value, creatine kinase, renal profile, maybe urine FME for urine myoglobin, and also maybe blood's present because of the nature of hematotoxic, because it's actually the venom itself is procoagulant, so it will cause coagulopathy. Okay, because the presence of the enzyme from the venom itself, it is risk of procoagulant. So we have to look at the features of bleeding manifestation. So that's why in the case of unidentified, we are going to monitor serial blood investigation, monitor the patient, and also we're going to do rate of proximal progression. Okay, if let's say patient who has this, the patient became hypotensive, yeah, maybe risk of cardiotoxicity from the marine envenoming, okay, or obo-obo, a jellyfish, okay, so we have to give symptomatic analgesia and also possible box jellyfish antivenom. But this one is more, I think, at the Sabah Sarawak lah. Okay, and then we are going to monitor if unidentified and animal bite without features of local or systemic envenomation, then only we are going to safely discharge patient after 24 hours. If we have this, in contrast, if we have a specimen, for example, patient bitten by phyton, for example, so you're going to, this non-venomous snake, but it's potentially harm because it can cause tissue injury as a result of bitten. So you're going to do wound management, dressing, you're going to give ATP, and also do an X-ray to look for any teeth that is embedded inside the bitten part. And so this patient can be discharged after maybe foreign body removed, discharged with analgesia, and actually no need for observation, in fact. So that's the difference management. If we know this is unidentified versus identified. If identified, there's way much, very much helpful in terms of management. If unidentified, maybe we have to, we do practice observation for 24 hours.
Okay, Dr. Izni, a bit of extension from that question. Sometimes patient comes days after the bite without any earlier treatment. How do you approach late presentation like this, especially if the swelling or necrosis has already set in? And maybe Dr. Izni, can you share your finding from your previous research thesis on public belief about alternative treats like BOMO and pawang for these snake bites? Because maybe some patient believe in that. That's why they comes days after the bite.
Okay. Thank you for the question. So, for example, delay. So the question is delay seeking help to the hospital or clinic kesihatan or GP following snake bite. So there are a few myths about it because this is their traditional belief. Okay, why exactly they seek treatment late? Because they think, number one, they have no awareness at all. Okay, there is no awareness of snake bite management, so they are not aware of the clinical impact towards the patient. Probably it's just a simple bruise, for example, simple bruise, so they thought it's a simple bruise that it will subside after maybe ice application, maybe after ointment, maybe. So they are actually, number one, is not aware of the management. So on top of that, probably financial issue, or maybe they are very away inside the rural health area, so it's very difficult access to go to the hospital. For example, the scenario in Sabah or Sarawak, yeah. So the forest area, very rural, so they think this is actually not dangerous, so no need to come to hospital, and eventually the patient died because of neurotoxic. So that's important for us to emphasize on the education as well as awareness following snake related injury. All right, so what happened as a result? So when they have an infected wound, when they have already damage to the tissue without systemic envenoming, maybe maybe there is no indication, if let's say delayed more than 48 hours. So the main concept of management is to analgesia, maybe antibiotic if you think this infected wound, and we need to help, we get help from our orthopedic or surgeon to do debridement if needed. And that's what will happen later is the wound. The wound is difficult to manage, especially when there is comorbidities here. Comorbidities meaning the patient is immunocompromised, let's say diabetic, hypertension at risk of microvascular complication, or patient with renal failure, patient who actually immunocompromised. So the wound management is going to be difficult, and it causes morbidity later. But yes, we do encounter such patient in Malaysia, such as Naja bite species. They keep for 3 to 4 days and then need debridement, antibiotic, complicated with surgical site infection, so delayed. What we call this? It's gonna be longer management inpatient mainly, and then as well as follow up. Okay. I would like to share my what we call this thesis. We do research during a master program together with Prof. Khaldun is my supervisor. It's actually about health-seeking behavior following snake-related injury. So we do consult REX. We do consult. Sorry, we get the data from REX, Renal Envenoming Consultancy Service. So per year they have like in the data log almost more than, I think, around 1,000, maybe less than 1,000, and then the data within 2019 2020. So how do we approach? Basically, we make a phone call to the victim of snake bite and we interview them. So whether we are asking whether they do seek treatment before come to hospital or after go seek treatment at the traditional healer. I mean, before going to hospital and after going to hospital. And surprisingly, there is actually 260 plus respondent, if I'm not mistaken. Only one came to the traditional healer before to hospital, but there is more than 20 plus what you call the respondent who seek traditional healer following discharge from hospital. Okay, so in this case, on top, that's the findings. And apart from that, we do ask what are the pre-hospital, what we call this, pre-hospital management by themselves before arrive to hospital, and 100 of them use tourniquet. Around 268 patients, 100 of them using tourniquet to immobilize the beaten limb. On top of that, use daun semambu. They ingested this daun semambu ular. Okay, I don't know what exactly the scientific name of the leaf, but they eat that. On top of that, they did squeeze the beaten limb. Okay, meaning the damage already happened as a result of beaten, but somehow they squeeze and they do suction by their own mouth. Okay, so at risk of contamination of the beaten part. Yeah. And then following after patient being discharged, and then there are also 20 plus patients who go to traditional healer mainly because for their reassurance, although we already did appropriate management in the hospital. And also, what are the reason behind this is mainly is their traditional belief. I think that's about it.
Okay, thank you, Dr. Izni. Also, since up until 2025, these traditional healers are still are still insist in our community. So maybe I would like to hear some comments from Dr. Tinesh and Mr. Adam regarding this traditional healer in our treatment of snake bite and stings.
Hello, let me start first. Maybe yeah, talking about the traditional healers, right? Of course, you can't stop them. There is too many of them out there, especially when you are dealing with all these animal bites and all that. Especially in Pahang, we have a lot of large community of OA or orang asli where they actually in that case their first place to seek treatment, they go to these traditional healers, okay, which in their own kampung and all that, they have their own pawang or like a bomo and what so on to seek treatment for whatever sort of treatment. Then they come delayed to us when they come like infected wound and stuff like that. So in that case, of course, you can't stop, but actually our job as a healthcare practitioner is to educate the public, or to do what is the right thing. Like I think we have discussed in an elaborate manner about what are the do's and don'ts, especially in snake bites, which is the most common animal bite that we encounter, or like more widely discussed compared to others. So but of course the existence of these traditional healers or bomo or whatsoever cannot be denied, and there is no regulation to stop them or a law to say that they cannot do certain things or cannot practice certain things. And most of the time they don't go like you see all these publics, netizen viral kind, all these doctors, medical practitioners, but they don't do this to the bomo or traditional healers, you see. So you can't actually stop them or any regulation or law, but only by educating the public, and we as a healthcare practitioners to practice the right thing when it comes to animal bites and stings. That is my opinion regarding these traditional healers in management of animal bites and stings. Probably Mr. Adam can add a bit more on that.
Okay, thank you, Dr. Dinesh. So I will add a little bit. So I think for us in hospital setting, you will need to work together with your public health colleagues to educate. Especially, I agree with Dr. Dinesh, especially for those orang asli, because they actually more believe their pawang rather than medical personnel. So we need to work together with public health to educate them so that they will slowly accept our management and the first aid or the treatment from us. We can't really stop because as I said, they actually believe them more rather than us. So you cannot stop. You just maybe we can suggest to the person that we do it together as long as the traditional way is do not further harm the person. So I think the best way is working together with our public health colleagues to educate, to continue educate, to give the proper correct management for this bite and sting. Thank you.
Thank you, Dr. Tinesh and Mr. Adam, for wonderful opinion. I got three devices here, and three of these devices received a lot of interesting question and got many of question that interesting. Love to ask. Wait a moment. Hello. Number two. Okay. We got two interesting questions for Dr. Tinesh and Mr. Adam received for animals attendant online. That is so interesting. So, Doctor, someone asking if someone got bitten or got bite or got stung for anything, complain of SOB, shortness of breath. Blood pressure is okay, no bronchi, but after bite of this bee or snake or anything else, they got this complaint SOB. Should we give a IV adrenaline? I am adrenaline, IV Priton, or I am IV hydrocot? First question for Dr. Tinesh. And the second question, also for anyone attending, for Mr. Adam, they said if we do get hit from when it was snap, maybe the snap just shoot dia punya what call bisa into the eyes, right? So what we can do in pre-hospital care? So Dr. Tinesh, is that you first?
Okay, thank you for the quite interesting question about whether if it's let me rephrase I takut salah jawab pula nanti. Just if it's a shortness of patient complain of shortness of breath, uh uh after the bite, after the sting, whether there is any role of hydrocot and piriton or whatsoever, adrenaline treating as anaphylaxis. Am I right? Okay. So if a patient complain of shortness of breath, I mean, of course, as a clinician, first you need to identify the core issue here. Why is the patient having shortness of breath? Are we really dealing with a true anaphylaxis here? So if we are dealing with anaphylaxis, of course you have like criteria to say what is anaphylaxis, right? So you have two system involvement, of course some urticaria rashes, okay, whether patient has an airway compromise, any rhonchi, all these any GI symptoms. When you see any anaphylaxis there, then of course there is a role of you treating it with hydrocorts, adrenalines, piritons, as a as a anaphylaxis per se. But if it's a shortness of breath, can be a lot of things. It's one of the main complaint in ED yang sometimes susah nak manage sebab patient datang cakap sesak nafas. So what is sesak nafas? What do you mean by sesak nafas? Is it a neurotoxic symptom due to a snake bite? Is the patient having some diaphragmatic issue, breathing issues due to a neurotoxic snake bite? Or is it anaphylaxis? So you need to be specific. I think it's back to basic. You need to get the history. You need to know what actually happened prior and after the bite and what actually beat them, what are the symptoms, okay, what are we dealing with, what is the reason for the patient to have SOB. You cannot just, if I tell you, okay, kalau patient ada SOB, regardless of whatever, just give hydrocort and piriton, then it will be like, that is a very wrong way to put it. So you cannot just like pukul rata for everybody say one management kalau SOB je bagi ni. No, it's not like that. So as a clinician, you need to get to the core of the issue. Why is the patient having SOB? What are we dealing with? Is it anaphylaxis or is it not anaphylaxis? If it's anaphylaxis, yes, I agree. You have to give hydrocort, plus all the other medication. Or if it's a true anaphylaxis, probably patient needs adrenaline, yes. But if it is not, then the management would differ. If it's a neurotoxic snake bite, patient having a diaphragmatic failure, patient is having respiratory distress due to that. So then you have to do that. Then the patient will benefit from antivenom. Your patient will not benefit from your hydrocort, piriton, and so on. So SOB, what is the issue? Identify first.
Okay, then, Mr. Adam, regarding the pre-hospital care for the eyes injury because of the snake.
Okay, so I think the questions you will be the venom, the snake spitting the venom into the person eyes. Okay, so the concept is just like chemical contact. You have contact with chemical. So anything is dilution is a solution for pollution. That's all. So you need plenty of water. Just irrigate the involved eyes. Keep on irrigate until you reach to the hospital. That is for pre-hospital action that you can do. Of course, you need to make sure the scene is safe, the ABC, everything, and then the specific first aid for pre-hospital, you just use a normal saline to irrigate the eyes. Plenty. So if it is best, you can irrigate up to 6 liters of normal saline throughout the transport.
Thank you for those correct answer from Dr. Dinesh and Mr. Adam. I hope that that answer can clear up for our anonymous attendee. So back to the question on the floor. This one, our dear nation, Dr. Siti, which is Dr. Izni, of course. Dr. Izni got fan and big fan here. So you got two questions from two person regarding the anti-venom from Miss Roy and Lato. So the question is, hello, sorry, as far as I know, there are many types of anti-venom for land snake. Is there only one anti-venom for sea snake, or are there also various types? And the second question for the TCT is, as far as I remember, government hospital only have two types of anti-venom. Is it true? Which anti-venom that we know for what type of snake bite?
Okay. Talking about antivenom, we for sea snake we only have one antivenom. Yes, only one antivenom, but the price is like I think almost 20 to 30K per vial, and you might need 3 vials. There is envenoming before toxicity, right? So you can like buy a MyV car or maybe a mask car, 50 to 60,000 if you're using for 3 vials, right? So it is very expensive. The sea snake antivenom is imported from Australia, if I'm not mistaken. So it is very expensive. So and we only have one type to cover sea snake. Meanwhile, for antivenom for land snake, we have monovalent and polyvalent. Okay, so for monovalent, meaning the antivenom is targeting to one particular species, especially when you know the identified culprit snake. For example, Naja species or cobra, if there is local or systemic envenoming supported with the history and clinical findings, so you're going to use Naja NKAV, yeah, so monovalent, so we have few, so not only two. If let's say we're going to categorize it into monovalent, meaning one antivenom targeting antidote to one specific snake. Meanwhile, polyvalent is like a group of toxicity, for example, hematotoxicity and also neurotoxicity. So you're going to use neuropolyvalent because it can cover few neurotoxic snake. Meanwhile, hematopolyvalent, you're going to give for it will cover 3 types of snake that is potential to be hematotoxic. Okay, so I describe about hematopolyvalent first. Hematopolyvalent is used for pit vipers, Malayan pit viper, what we call this, Salucelas marodostoma. So this is for Malayan pit viper, especially more common in Selangor upward, meaning towards northern. Okay, so this is hematopolyvalent. Meanwhile, for hematopolyvalent just now, you're going to use 3 vials for local envenoming and 6 vials for systemic envenoming. So there's we call this hematopolyvalent antivenom, HPAV. Meanwhile, for neuropolyvalent, those with paralysis, those with respiratory respiratory depression, apnea, so paralyzed already, no need to use fall into intubate, so the paralyzed with broken leg syndrome or with pupil dilated, so they manifest as neurotoxic, but you have no idea what type of snake. It can be cobra, it can be king cobra, it can be crane. Okay, so this neuropolyvalent antivenom, it will cover for Ophiophagus henna, so king cobra, Naja sumatrana, Naja cautia, and crate, Bungarus candidus. Yeah, so it will be we will use neuropolyvalent antivenom. So the dose will be 5 vials if there is local envenomation. Meanwhile, if systemic, that require intubation and all, cardiac arrest CPR, so already systemic envenoming, so you're going to use 10 vials, okay, over 1 hour. Meanwhile, for identified snake bite, that one is, just now I mentioned about polyvalent. So this one is about monovalent, meaning one species causing toxicity. So we target to that specific snake. So there are few. For example, we have NKAV, most common, Najacautia antibinum, we have. So only tackle Naja sumatrana and Naja cautia. Okay, and then we do have green pit antiviper, so GPAV, so need covering for green pit viper according to the name. And then we have specific CRAV, meaning Malayan antivenom, Malayan pit viper antivenom. Okay, so this one CRAV, Salus marudestoma antivenom. Okay, so it's monovalent. Others we do have crate, yeah, okay, crate specific for crate lah, bungaru species. Yeah, there are few. That's one is monovalent, meaning you have the species and you found out there is a local or systemic envenoming, then you can go for it, use the monovalent. But you don't, if you don't have, or maybe at your area doesn't have the specific monovalent, so the other option will be you have to use hematopolyvalent. That's one. For example, you bitten by green pit viper. In PD, we do have common case bitten by mangrove pit viper. So this mangrove pit viper, is a group of green pit antiviper. So you're going to use GPAV as a monovalent. But if we don't have it, maybe the alternative would be using hematopolyvalent. So that's the difference, because hemato can cover 3 species. In comparison to green pit, it's going to be specific target to the green pit viper. So the answer is not only 2 antivenom we have for land snake, systemic or local envenoming. We have a lot actually. I think maybe 7 to 8. For for polyvalent, we have 2, but there are few 5 to 6, if I'm not mistaken, are monovalent.
Okay, Doctor. Thank you, Doctor. We going to have our last question. I open the question for all our panelists. The question is, what is your vision and hope for our management towards a patient that involve in animal bite and sting in the future? I open the question for all panelists.
Okay, maybe I go first. Thank you. So I think as a paramedic, because the organizer is also paramedic. So I think all of us should be bear in mind there's no such thing as hydrocodone for all bite and sting cases. That is actually what we gained during our practical posting last time. It's a very old, is incorrect actually practice among us. So we must stop it. We must do it evidence-based treatment for the patient. And then you all must remember the treatment is actually based on your clinical judgment. What you assess, what the patient have, and then what is your action, what you want to give. Everything is based on your clinical assessment, clinical judgment. Then you think whether the patient needs hydrocod. Is it the person need piriton? So it's not one rules fits all. No. So as well as the SSD cream, this kind of funny treatment, we should stop it. Okay, so thank you.
Next, maybe Dr. Dinesh can share your insight.
Yeah, I think the vision is generally from a less famous part of emergency, which is animal bites and all that, to making it a more available and more understandable for healthcare practitioner. Okay, the effort by the team, the Rex team especially, to make it more available for everyone. And I think moving forward, I think it should be a good a collaboration between the paramedics and also the emergency team, the emergency doctor, the public health and all that, for it's a multi modality or multidisciplinary management, okay, for a effective management of animal bites and sting in future. So I think that's our vision, to make a better better outcome and to save more lives lah.
Thank you, Dr. Dinesh. Next, Dr. Izni.
Okay. They are actually not only snake bite, but I think there is our community, there is a lack of awareness and education. So as we discussed earlier, the seeking what we call this health seeking behavior, yeah, going to traditional healer is very difficult to be eliminated from our society. So maybe in the future, maybe it's difficult for us to how do you call this eliminate this belief immediately. So it's gonna take long time. For example, maybe we can do a community outreach program. So it's not uh, community outreach program can be used macam face to face, like giving education towards the public. But maybe you can in this era, so people are trying move away from this paperless thing, so they are going towards seeking treatment via social media. So I realized there is a concept of active social media user who are actually, hey, I'm having chest pain, for example. What should I do? Why didn't you go to the hospital? So for example, have you bitten by a snake? And then they upload in the social media, and then what am I going to do? So then only have you ever read the comment section? So please go to this traditional healer in Malacca, for example. Please WhatsApp my number. I have this batu geliga like a stone, a special stone, whatever. So why don't you use campur this daun semambu ular together with whatever? So they give false information to the public, but somehow our public do believe them. So it's difficult for us to control via social media. But the other way around, maybe we can do education via, sharing short videos. So because it can be proper educational teaching. So because they have low attention span nowadays, maybe short video 1 to 2 minutes might be helpful. Not everyone knows, because we're in the healthcare, we know where to seek treatment. For example, we consult toxinology, REX. Remote examination consultancy service. We do consult them. We do have access to the information available, but for the public, they might not read the whole the whole guidelines or whatever. They just go and seek treatment to the influencer, for example. So you guys can maybe maybe you can share the information through the social media about do and don'ts, and then a bit about education, maybe a bit about basic life support, to treat patient, and maybe wrong myth about the false belief. And I think that one can be done, because I know everyone is already Gen Z, Gen Alpha now. We are millennials.
but still look young, doctor. No worries, still young. Thank you for the opinion. And for the audience, don't laugh yet because we got a wonderful activity soon. So again, that was a just powerful and insightful session we had today. A big thank you to all our wonderful, knowledgeable panelists, Dr. Siti Noizni, Dr. Tinesh, and Mr. Adam. Thank you. And our amazing participant on the floor, you were all awesome. So ladies and gentlemen, let's test how much we have learned and how much information we gained through this webinar. So because it's Kahoot time. So our Kahoot session we will conduct by Professor Dr. Khaldun. Professor Dr. Khaldun, ready?
Okay, everybody is welcome to join in. Number 3, Mamal. Number 2, Kumar. And the champion is Tilo.
Congratulations to our top scorers. You have officially earned bragging right for today. Well done, everyone. Before we wrap up, I would like to invite Dr. Siti Noizni Sheikh Muhammad Amin to give our closing speech. Dr. Izni, thank you for being with us today. The mic is yours.
All right. Thank you everyone for this what we call a golden opportunity to share the knowledge. Yeah. First of all, I would like to thank to Prof. Khaldun who guided me during postgraduate studies, and then these few seminars for the knowledge shared, and also thank you from us as a panelist, Dr. Dinesh, and also Mr. Adam for the good opportunity to share our information regarding animal bites and sting. And then I would like to thank the organizers as well because their hard work and the dedication put towards this forum. And then the video is actually an interesting video. Who are the actor and actress? Do you guys same batch or what? This is all paramedic, right? The video is interesting. Okay.
The video is available on YouTube. You guys can use it.
Okay. Very creative. Start with okay.
Those are all
Lifting and snake bite lah.
paramedics.
Paramedic student are very creative lah. So we can see the effort behind the scene. Okay, it was actually educational. So to all participants, thank you for your active engagement. I think there are a few more questions that we did not manage to answer, but it's actually interesting and a very thoughtful question. So your curiosity and enthusiasm has made today's discussion very vibrant and meaningful. So once again, thank you everyone for your time, attention, and commitment. It has been a privilege to share this platform with all of you. All right, have a wonderful day. Thank you.
Okay, guys, before we officially close today's session, you can see there's promotion for Congress 2025 Animal Marine and Management. You can see anyone yang interested can register that. Okay. I'd like to take a moment to express my deepest gratitude and appreciation. First and foremost, congratulations to the entire organizer team, my team, cohort 12, for the tremendous effort and teamwork that make this animal bite and sting webinar success, from the early planning stage to the long meeting to the final round to this. Each of you play an essential role. And to our beloved speaker and panelists, thank you for your sharing expertise, experience, and valuable insight. Your contribution truly enriched our discussion and helped bridge knowledge between clinical, emergency, and pre-hospital care perspectives. Thank you again. Thank you so much being here. Our webinar, Animal Bite and Sting. Hopefully, this information can top up our knowledge and
we keep what we call improve ourselves. Thank you.
And also, Yusri, don't forget to fill out the feedback form and grab your e-certificate. Until next time, stay safe, stay alert, and remember, not every animal is friendly, but knowledge always is. Have a great day, everyone. Bye-bye.